This is Emily Buckley, and she's going to be doing the speech and language part of the presentation. And she is a speech language pathologist at Cincinnati Children's Hospital. And her area of interest and expertise is working with children and families impacted by delays, birth to 3, and then feeding challenges. And she's been a speech pathologist for 5 years? Yeah. 10 years, yeah. Over 5 years. So yeah, 10 years is a lot more over than 5, yeah. Okay, so I will let her go ahead and get going.
Okay, thank you. All right, I'm really glad to be here today, and I participated in some of the research studies for the speech and language evaluations this morning and met a lot of nice families and really sweet little kids here today, so thanks for having me. So I work at Cincinnati Children's Hospital, and the reason that I am presenting today is I had the great opportunity to work with Ava. I'm sure a lot of you know Ava. She's going to be the star of my show here today. And her mom, Melissa, asked me to come and talk today about my experience in working with Ava and her communication skills. I've worked at Children's for about 10 years, and like you said, I work with a lot of different kids, mainly younger kids. So I started working with Ava when she was about 18 months old, so it's been quite a few years ago. And she was initially referred due to having some difficulties with feeding skills, but she quickly developed good functional feeding skills, and so we started working on her communication skills. So kind of as I'm doing my talk, I'll tell you about my experience with Ava and some of the goals that we worked on. So the overview of what I'm going to talk about, I'm going to talk about speech sound disorders and what they are and how to differentiate between some of the different speech sound disorders and why speech sound production might be difficult for kids with 1P36. I'm also going to talk about language skills and the difference between expressive and receptive language skills, and also nonverbal communication options and how to get kids communicating when speech and language is challenging for them, and also augmentative communication, what it is, and some different options for that, like sign language, use of gestures, pictures, and high and low tech communication devices. So what are some speech sound disorders? Well, articulation is one of them, and this is when kids have difficulty making speech sounds. So they may substitute sounds, they may omit or delete sounds. So one example of a substitution is if a child has difficulty making the K sound, they may say T for K, like tup for cup. They might leave the K sound off completely, like B for book. And then another articulation disorder is a distortion. So a common one is a lisp. And if you think about Sylvester the cat from Looney Tunes, he has quite a recognizable lisp. Another speech sound disorder is a phonological disorder, and this is when kids can make the speech sound, but they have sort of a substitution pattern. So they substitute other sounds for more difficult sounds, or they can even just leave sounds off. So Tweety Bird has a phonological disorder. When he says, I taught, putty tat, he has a lot of substitutions there. Another speech sound disorder is apraxia. And in some of the research studies this morning, we are finding that a lot of the kids coming in today do have apraxia. And apraxia is a motor speech disorder. When children have apraxia, it causes their speech to be very unintelligible, so it can be very difficult to understand. Children with apraxia may have difficulty saying words or even saying individual speech sounds. And they may be able to say a word or sound clearly or correctly at one time, but then when they try to say it again, it sounds incorrect. When children have apraxia, the brain has difficulty planning the movements of the tongue, lips, and jaw for the correct positions for speech sounds. So it's not caused by muscle weakness or paralysis. And oftentimes children with apraxia know what they want to say, but they're not able to coordinate the motor movements to make the correct speech sounds. These are some signs of apraxia in younger children and older children. So a lot of times younger children, usually infants up to 18 months old, they may not coo or babble, and a lot of times they're described as a quiet baby. They usually are not saying their first word by 12 months, and they may only make a few sounds, a few speech sounds, and they're not able to combine sounds to say words. So maybe they can just say a sound in isolation like ba or pa, but they're not able to say papa or dada. They may also have problems with eating and drinking, so like chewing or transitioning to cup drinking from the bottle. Older children, oftentimes you start to notice that they're making inconsistent errors. So maybe you hear a word one time, or you hear them produce a word correctly one time, but then you don't hear it said correctly again. They may also have difficulty imitating sounds and words correctly, and they may have facial groping or grimacing while talking, so you can tell that they're trying to get a word or a sound out, but they're just not able to coordinate those movements. Longer words or phrases are more difficult to say, so maybe when the child says just one word at a time, they sound very clear, but then when they try to put words together to form phrases or sentences, a lot of times they're more difficult to understand. A lot of times these children have good receptive language skills, so they can understand things, they can understand directions, they can understand the words that you're saying to them, but they're not able to express things back to you. And they may also have other motor planning problems like gross and fine motor planning difficulties. They walk later, they're crawling later, their hand-to-mouth skills like for self-feeding or drawing or writing are oftentimes delayed and difficult. Also, some kids with apraxia, when they start making sounds, they may not be making speech sounds. They might make other sounds, sounds in their throat or sounds that we don't typally produce in speech. Sometimes they have some trouble pairing together consonants and vowels. And like I said, older kids, they start to say words, and maybe you hear it one time, but you don't hear it again. So this is Ava. She's on her way to physical therapy here. So, learning to walk was really challenging for Ava. She worked on it for a long, long time. And sort of as her gross motor skills started to develop, we started to hear some more speech sounds out of her. So her body was just becoming stronger and coordinated, and that also helped her speech sounds. And she worked really hard in physical therapy and is doing great with walking and moving around now. So the diagnosis of apraxia can be made by a speech therapist, and it can be made once children start talking. So a firm diagnosis of apraxia is difficult to make when children aren't talking or saying words yet, because we need to hear them making sounds, trying to say words, so we can look for those inconsistent errors and some of the other characteristics that I talked about earlier. And also, a hearing evaluation is an important part of the diagnosis of apraxia. So we need to make sure that the speech sound errors are not happening because the child has a hearing loss. Okay. So for apraxia treatment, there are a lot of different philosophies out there. One of them is called prompt. Another one involves using touch cues. There's the Kaufman approach. There's moving across syllables. So there are a lot of different things out there. Most of these philosophies are kind of based on the same thing, and they're based on theories of motor learning, where consistent practice, consistent ability to make the sounds correctly will lead to just more automatic ability to say the sounds. So a lot of times we start with basic sounds, consonant and vowels in isolation, a child being able to imitate those sounds, and then working towards sound combinations and syllable shapes. So like consonants and vowels together, consonant, vowel, consonant, and on and on. And so we kind of build up and make it more challenging. So again, the different speech sounds disorders that are out there: articulation disorder, phonological disorder, apraxia of speech. And children can demonstrate either one of these speech sound disorders, or two of them, or all of them. Each child is different, and any combination can happen. And the best way to work on these disorders is just frequent practice of speech sounds and syllable shapes and sound combinations. So when children have severe difficulty making speech sounds, it's really important to give them a way to communicate non-verbally through the use of gestures, sign language, pictures. And research proves that the use of augmentative communication supports the development of oral language. So a lot of times parents are worried that if they give their child a way to communicate non-verbally, like through the use of pictures or sign language, that they're just going to stop talking or maybe not try to talk at all. But actually the research proves otherwise, that it really promotes verbal communication. So, if your child is trying to say some words or making sounds, I'd encourage you to build upon that. It's good that they're attempting to verbalize and make some sounds. So now I'm going to talk about language skills. So language disorder happens when a child has difficulty understanding others or sharing their thoughts, ideas, and feelings. And language disorders can have an impact on learning, behavior, and social skills. Children may struggle with expressive language, receptive language, or both. And expressive language can be impacted by speech sound disorders like apraxia. So this is kind of tells you about expressive language and receptive language and the difference between the two. So expressive language is kind of like a child's vocabulary, so all the words that they're able to say. It could be their verbal vocabulary, so what they're saying, or their nonverbal vocabulary. There are a lot of kids here today that are using sign language really nicely. They're using a lot of different signs. They're using pictures. So all of that goes into expressive vocabulary. It also it deals with sentence structure, so how kids are putting words together to form sentences, and then being able to find words and use the right word in the right situation. Then receptive language is understanding words and sentences, so things like following directions, attending to speakers, and learning and remembering new concepts. So children with 1p36 deletion syndrome can demonstrate communication deficits related to motor speech disorders, expressive language, or receptive language impairment. So how do you teach your child to communicate when they're faced with so many of these challenges? So these are some options and some places to start. So pre-linguistic communication is kind of a mouthful. Before children learn language, they express themselves using gestures, vocalizations, facial expressions, and body language. And before children can learn to use symbolic communication, like saying words to represent objects, or pictures, or sign language, or an iPad for communication, they need to be able to use pre-linguistic communication. So many parents think, if they buy an iPad or a communication device or use an app, for communication, and they give it to a child, they'll automatically be able to use it. But many things have to happen before a child can use a symbolic type of communication system. So that's why I want to spend some time talking about pre-linguistic communication and why it's so important. So what does pre-linguistic communication look like? Well, we can see Ava here. She's clapping, she's smiling. So just by looking at the picture and her body language and the way she's moving her body, we can tell how she's feeling. She's expressing something. She's happy. So some other pre-linguistic communication are waving, smiling, clapping, turning away. Most kids, even when they're nonverbal, they may not have a way to say no, but I've never met a kid who is not able to express no. They can all express no in some way, like pushing things away, or that kind of thing. So those are all pre-linguistic forms of communication. Sometimes kids, they reach out for items, they point to things that they're commenting on, like, hey, look at that, or I want that. They might take your hand and put it on a toy, to turn it on for you or to open something. They may just look at an object to show that they're interested in it. And definitely making eye contact, using eye gaze, touching someone to gain their attention. These are all forms of pre-linguistic communication. So why is this important? Well, it's useful in teaching symbolic communication. It has to come first. It helps kids learn the cause-effect relationship of communication. So they learn if they reach out for something or if they smile, they get a reaction from others. It also increases social interaction, and that's a big part of communication and motivation to communicate. It involves using gestures that can be understood by many communication partners. So, everyone understands, what a point means. It gains attention and people look in that direction. And it helps children express feelings, wants, and needs. So, I'm going to talk about a quick 5-step plan to teach pre-linguistic communication if this is something that your child is still working on. So step 1, set a goal. It might be to teach a new gesture. It could be to encourage consistent use of a gesture that your child already knows, or it could be working on vocalizing. And for example, maybe your child has a toy that they like for you to turn on for them, and they just hold it and look at you when it stops, lighting up or the music turns off. A way to kind of build on that would be to encourage your child to hand the toy to you, because that's something that a lot of communication partners could understand. So if you're wondering where to start, think about what your child likes and dislikes, or what they're really motivated by and interested in, and how does your child express that to you? And then is there a way to make your child's gestures or vocalizations more clear or more consistent? Let's see. Okay. So step 2, establish a routine for this communication interaction. So you're probably already teaching your child pre-linguistic communication during routine activities like imitation games. So when I walked into the room, I saw a lot of parents and family members interacting with kids and noticed a lot of this happening. So making sounds back and forth to each other, clapping at the end of a song, smiling back and forth, taking turns playing with a favorite toy, doing something silly or unexpected during a routine activity, like putting a sock on your child's hand while dressing instead of putting it on their foot. And a lot of times that creates a reaction in them. They express something. So other games would be like hide and seek, peekaboo, just little repetitive games or interactions that your child anticipates or initiates with you in some way. Other toys that are really good for working on this are like, a lot of times the toys you can get at the dollar store, like the squishy balls that light up, or the little like flashlight things that spin around and light up, or things that make music, that play music for a short period of time and then have to be turned on again. So this is Ava and I here. She's clapping at the end of her favorite song, Itsy Bitsy Spider. And, she was clapping before I started working with her, but she definitely learned that through imitation and repetition and games that she played with her parents. So we were able to build on that a little bit by using she started using the gestures and hand motions for Itsy Bitsy Spider, and eventually we started to use picture symbols for Spider so that she could be understood by others to, exchange a picture with someone to say, I want to sing Itsy Bitsy Spider. These are some tips for setting up your house or your home to work on communication with your child. So you want to make sure that you limit distractions, auditory and visual distractions, which is easier said than done, I realize. But, you want to make sure you turn off the TV, try not to, answer your phone or be looking through your phone, and try to make sure that you're really present with your child and you're spending some good one-on-one time with them. Also, make sure that your child is well positioned and supported. So a lot of kids with 1P36, they have some motor challenges, and we don't want them working hard to sit up or support themselves while they're playing. We want them to be well supported so that the focus can be on communication and not on motor skills at that time. And, be fun and animated. You get to be a kid again. And then plan to practice for about 5 to 10 minutes. And there are good days and bad days with all kids. It might not be a good day to work on communication, and that's okay. Try again tomorrow. Okay, so step 4, follow your child's lead. So this involves allowing your child to choose the toys and activities that they find interesting. So in allowing your child to choose the toys and activities, when they find them interesting, they're more likely to attend to them for a longer period of time. And also allow your child to play with toys the way that they choose during this time. So, some kids, instead of just driving a car around, they like to watch the wheels spin, and that's okay. That's their way of playing with it. And if we're working on getting them to motivating them to communicate or express something, it's okay to allow them to play with the toy the way that they like. Let's see, children are more likely, I said that, okay. Don't give directions. So instead of telling them what to do with the toy, just praise them for playing with it and attending to it. And then also don't ask questions. We don't want to pressure kids by asking a lot of questions, especially when they can't respond very well. So instead, just try commenting and labeling, like, you like the musical toy, you're holding the toy, that kind of thing. Okay, and these are some strategies for teaching gestures. Pause for longer than usual during a routine to give the child a chance to respond. So, maybe pushing your child on a swing, let the swing stop and see if they can show you that they want to continue it by, rocking back and forth, making eye contact with you, vocalizing. Also look for subtle attempts to communicate that your child is using, like eye contact or eye gaze. Maybe they're looking at something they find interesting for a long period of time. Also look for facial expressions. Offer gentle prompting with hand-over-hand assistance. So if your child looks at you when their toy stops, maybe you can help them hand the toy to you. Take it one step further. Never force, though. And then use gestures yourself while you're talking to your child during playtime and routine activities. Point things out. Model reaching for things so that they can see you doing the same. Some more strategies are to place desired items within view but out of reach. So maybe you put their sippy cup up on the counter where they can see it but they can't reach it. And you look for them to point to it, or you look for them to look at it instead of just always anticipating and giving it to them. Use toys that your child would need help with. Like a lot of times with kids, I use the little wind-up toys, because they jump or spin for, 10 to 15 seconds or so and then stop. And then the child can hand it to me again and I activate it again. So those are toys that are good to use when you're working on this. Also give only small amounts of desired items, like, just a handful of Cheerios rather than an entire bowl, or just a short video clip of a video that a child likes to watch so that they have to ask again, just while you're practicing to get more communication attempts out of them. So some resources for pre-linguistic communication. I really love this website, the National Consortium on Deaf Blindness. It can be pertinent to lots of different kids, even if your child doesn't have a vision or hearing impairment. I think what's so great about it is that they have video clips demonstrating teaching gestures and vocalizations and shaping gestures for kids. So I found it really helpful in working with kids. Another really great website is Design to Learn. They have a communication matrix, which is an assessment that parents or therapists or teachers can use, and it's a free tool designed to pinpoint exactly how an individual is communicating and to provide a framework for determining goals. So it just asks a lot of yes/no questions like, is your child vocalizing? Does your child reach out for items? Does your child point to items? And it kind of helps you figure out exactly how your child is communicating and maybe some goals that you can work on. So that's really helpful too. So now I'm going to talk more about symbolic communication, and I'm going to start with sign language. So once your child is using gestures regularly, you can move on to symbolic communication like sign language. Your child must understand the cause-effect relationship of communication before he or she will be successful with sign language. So they need to know that, the sign has a purpose. I'm going to get something from doing this. So many first signs that parents like to use are eat, drink, help, open, all done, mommy, daddy. And signs must have meaning to the child or to the children and are most successfully used in the here and now. So, a lot of times parents will ask their child, sign eat, sign all done. Well, if that's not happening right now, then they're probably not going to do it. And it's best to pair those signs with the moment when it's happening. One caution with teaching the sign more, a lot of kids know that sign. Sometimes more becomes everything, and children get stuck with more, and so it's always good to teach them a diverse vocabulary, because sometimes, more becomes everything. When they want something to eat, when they want to play, they're just signing more. So, to kind of break out of that habit, I always recommend, more what? What do you want more of? And we do a choice then to try to teach some other signs there. So, be careful with more. I do use it, for cause effect, but I always like to expand on that too. Some benefits of using sign language is that it's somewhat universal. It seems like a lot of people know sign language now, at least basic signs. A lot of teachers understand it. Even a lot of daycare centers are teaching it to, all children, typically developing children too. So I think it's becoming a lot more universal than it used to be. And signs can be made up by your child as long as they're used consistently. So children with apraxia or motor speech disorders, a lot of times they're notorious for making up signs, and I always love to see the signs that kids make up themselves. And then I just listed a website here for a sign language browser. ASL means American Sign Language, but you can, type in the word that you're looking for and it'll show you a video clip of how to do that sign. Next, I'm going to talk about PECS. And PECS stands for Picture Exchange Communication System. And PECS was originally developed for children with autism, but it's now used by children and adults who have a variety of diagnoses. It begins by teaching a child to give a picture of a desired item to a communication partner who immediately honors the exchange as a request. Stage 1 PECS requires 2 adults, so there's usually an adult sitting behind the child and then an adult sitting directly across from the child. So the adult sitting behind the child helps to exchange the picture. They just provide hand-over-hand assistance to exchange the picture to the other person. But before beginning stage 1 PECS, children must be consistently reaching out for desired items. So they have to have some motivation to communicate. So when the child reaches out for something, then the adult sitting behind the child can take their hand, to get the picture and then give it to somebody. So we wouldn't just take the child's hand and pick up the picture and give it to somebody, because they would have no meaning. They're not motivated to ask for it themselves. So we want them, that's why we want to start with pre-linguistic communication. We want kids to learn how to reach out and gesture for things. So let's see. So like I was saying, when the child reaches for the desired item, that's when we then help them to grab the picture and give it to the other adult. And PECS is very specific. There's no praise, like the adult sitting behind the child doesn't say, get the picture or good job or anything like that. They're completely silent. There are no verbal or gestural cues. We don't point to the picture or say, get your picture, anything like that, because those cues are so difficult to fade. So it's best to start out without cueing. It's just the hand-over-hand assistance. And PECS has been very successful with children and adults who have different cognitive, communication, and physical abilities. Some children who had very low cognitive skills, even I thought they were maybe at like a 6 to 9 month level, have been successful with using PECS, at least like stage 1 or 2. So a lot of kids can benefit from using it, but you have to start with the pre-linguistic communication first. Some children who start out using PECS go on to develop improved verbal abilities. So a lot of times when kids exchange the picture, sometimes they end up being able to say that word. Other children can go on to use voice output systems or more high-tech communication systems. So like some of the apps on the iPads or some other devices that are voice output. And there are 6 phases of PECS. And each phase of PECS is taught in a very specific manner. Like I said, there's specific cueing. Cues are faded, and it's very systematic. So if you think your child would benefit from learning PECS, you have to work with a speech pathologist who has the training in PECS. So it's a specific training that we go through. This is some information about PECS. They have a website. There's more information about the 6 phases. There's information about training. Some parents have gotten PECS training too. And then there's a lot of research to support the use of PECS. And the reason PECS is so specific is because the research supports that specific use. It doesn't support deviations or variations of it. So, and then the Mayor Johnson makes a program called BoardMaker, and we use that program for creating picture symbols and importing photographs. So that's how we make the pictures that we use for PECS. And this is an example of some high contrast picture symbols, and this works really nicely for kids who have difficulty with visual attention or maybe have some visual impairment. The picture really kind of jumps out on the page because it has a dark background. And then these are just kind of some traditional pictures, and they recently updated their pictures, and they're a little bit easier to understand. I think they represent the symbols a little better. And this is just an example of a PECS book. It's just a little binder, with some picture choices on there. And then this is Ava and I working on using PECS. She was really motivated to request either a snack or a song. So we started out just using gestures, reaching out for a desired item, and then we kind of shaped that gesture by reaching for the picture. She learned to discriminate between a desired item and a non-desired item. So there was a picture of a snack and then a picture of, a random item like a ball or something like that. PECS, once we got to discrimination, it was a little difficult for her because of her visual attention and visual skills. But we worked on that. We used one large picture, which was a preferred item, and then a small picture was the non-preferred item. Okay, so now I'm going to talk about some other augmentative communication options. Augmentative communication is a way for people to communicate when they don't have the physical ability to use speech or writing. Augmentative communication can be used for children who don't talk at all, or for children who do talk but are not able to be understood. So a lot of kids with apraxia can use AC. Many children with autism, apraxia, and various diagnoses use AC while they're developing and working on speech skills. So these are some low and high tech options for augmentative communication. So like low tech ones would be some we already talked about, like sign language, PECS. There are different buttons and switches out there, like a Big Mac switch you might have seen, and then there are just devices that can play recorded messages. And then some high-tech options would be like a computer or an iPad with an app that's programmed with several pages of vocabulary. I know I was talking to another mom whose child uses Proloquo to Go, and that's a pretty complex app that's used on the iPad. Augmentative communication is most effective when the child and family members and educational team is trained to use the system. So just because a child can use it in therapy, that's not going to be very effective. We need to make sure that the whole team is involved in understanding how the system works so that the child can use it in their natural environment. AugCom can help children to improve their ability to interact with others at home or in the community or in school. And using AugCom can help children to become more independent and may help to reduce negative behaviors. So, working with a speech pathologist who specializes in augmentative communication is crucial. For example, at Children's Hospital, we have a very specific procedure for referring patients for augmentative communication evaluations. So before a child can be referred for the evaluation, the treating therapist must consult with an augmentative communication team member. So our therapists at Children's who work with patients who are using AugCom devices, they are involved in additional training and additional competency work so that they can work with those patients. So we have to consult with them first. The patient must also have been exposed to using picture symbols like PECS or just at least exchanging pictures for requests. They must demonstrate competence with a low-tech system like PECS or a communication board or just a simpler voice output type device like the communication builder. And the family has to commit to being ready to train and learn how to use the AugCom system. So it also So those things have to happen. And then if the child has any physical or positional or visual needs or issues, then we do a separate referral to the Perlman Center, and they specialize in access. So if a child isn't able to just access and isolate their finger to access the device, we want to have some other people look at them and make sure that they're going to be able to access the device using eye gaze or other types of systems that are out there. So once again, the iPad, it's very easy to obtain, but it might not be appropriate for all kids. And even within use of the iPad, there are so many different apps that can be used. So we want to make sure that the right system is being used. So kind of putting all these things together, total communication is sort of a philosophy that many speech pathologists use. It was originally developed for children with hearing loss, but it can be used for any child who has difficulty communicating. And it really incorporates all means of communication, like use of formal signs, natural gestures, body language, and possibly even an AugCom device. So parents and teachers who are working on total communication with kids are encouraged to use whatever tools or means of communication are most effective for that individual child. So if they're outside at recess, maybe using signs to communicate there is best. When they're inside the classroom and they're seated at their desk, then maybe using their iPad is most appropriate in that situation. So the focus is on the development of language learning and use, not use of a specific type of system. So these are some resources here for augmentative communication. I really like this first one here. It's a blog that is written by a speech pathologist, and it just has a lot of practical ideas for augmentative communication use, and it advocates for safety awareness for AugCom users. And then there's a couple other ones there too. So, I'm sorry, did you need that? Okay. I don't, but I'm wondering if there's a way that I can maybe give my presentation to you guys or email it to somebody so you can have access to it on your website.
If you email it to me back here, I can make sure everybody,
okay.
we can link it on the website.
Okay, great. Yeah, I'd be happy to do that. Let's see here. Okay, so the next slide I'm going to talk about working with a speech therapist. Did you have a question? Okay, sorry. You want to seek the support of a speech pathologist to assist you in helping your child reach the goals that you have. I know some people, may live in an area where they don't have access to, a big hospital like we're lucky to have here in Cincinnati. And just know I think healthcare is changing a little bit, and we're trying to provide different models of therapy for families so that you don't have to go to therapy once a week, to work on the goals that you have for your child. We're trying to educate parents better and get them more involved so that they feel confident in working on the goals that they have for their child. And frequent practice at home or with communication partners in the natural environment is really most effective in helping children reach goals. So this is Ava here, and I just want to say that I'm really proud of her and how hard she works to keep learning and growing. And I'm also really proud of her parents, Shane and Melissa. They always come in with a smile on their face. They've been faced with a lot of challenges, and they just never give up. So I think that's one of the reasons that Ava does so well. This is my contact info. If you have any questions about what we talked about today, feel free to email me or call me. And then should we spend some time answering questions, or do you want to get started with yours? Or okay, I can answer a few questions if anyone has something.
I was just wondering, my son says he's working with the pictures with his speech therapist through First Steps in Indiana, and they said there's only 3 phases and that he was on the 2nd phase. So is that just like First Steps way and they don't work on anymore, or do you know if they needed to be updated? And my other thing was, there's 2 parts actually. The other part was, he's been not actually reaching for toys or anything, but he makes like a sound when he wants them. Basically, he wants them and then he'll make a sound if you take it away.
Okay.
So, but they're saying not to actually hand the photos, like he doesn't have to hand it to them, but just to tap it. Is that still okay, or are they doing wrong by teaching them that?
It sounds like they're trying to use pictures with him, but maybe they're not following, exactly the, excuse me a sec. They're not following PECS exactly, So, like I was saying before, there isn't a lot of research to support like variations in PECS. The research does support, true PECS, following those phases exactly. There are 6 phases to PECS, and maybe he's on the 2nd phase, and maybe they're going to go to the 3rd phase once he gets through the 2nd phase. I'm not sure, but and then your other part of your question, as far as like vocalizing when he wants something, that's great. I think you could definitely build upon that and maybe work on using a gesture also with vocalizing when he wants a certain toy. Yeah.
This is one of the first times I've seen the progression, the way you said it, with needing to be able to go from point A to B, C, D to go to the augmentative communication device. For example, my daughter's signing pretty well. She's signing very well when you ask her sign cookie, sign more, sign, but she doesn't use it really productively, but she probably knows 50 signs. She taught herself watching signing times. So we know that she understands what she sees.
Yeah.
I'm not sure, we don't work with PECS at home at all, and I know that they used it in her preschool very lightly. I've never really heard about the 6-phase process. There's specific speech therapists that just work on PECS, and do you need to go from signing to PECS to augmentative communication? Because we have an augmentative communication device through an iPad. They used my first ACC, and I feel like it's a waste with her. It's a button pusher. And I know she understands it a little bit, but she just thinks it doesn't really help her that much. So I'm trying to understand, did we miss a phase in between there that we should go back to? Because I know she wants to communicate, and I really believe she's able to. We just haven't really found maybe the right way for her.
Kids will use the system that is most efficient for them. So it sounds like at this time, sign language is most efficient for her. But perhaps if we spend some time teaching her, using pictures, and that they can represent some items, and that using pictures is maybe more universal than using signs, that all people can understand pictures. And the more efficient that she becomes in using those, then maybe the more efficient she would become in using an iPad app. But it sounds like, we might have missed a gap in there, that we need to go back and work on using pictures, because, sign language, there's no visual discrimination. It's just using the sign that you have. But with using PECS, it requires visual attention. It requires visual discrimination. So there's a whole another piece in there that needs to come before using an iPad, which requires a lot of visual discrimination, precise motor movements. So I think that maybe you could try going back to using PECS. But yes, PECS is very specific. There are phases that you go through. After the first phase, the second one is called distance and persistence. So the child, I have to be able to move farther away from a child, and they actually have to pick up the picture and bring it to me independently and initiate that communication with me. So that's an important part to learn before even moving on to discriminating between two pictures. So, all right, a couple more.
My son has a wonderful expressive language. He has great expressive language, very clear, very understandable. His diction's fantastic, but his receptive language is years behind his expressive. So he can say bird, but has no idea what a bird is. Okay. What do you think is the most helpful technique for kids? Because I know that's not very common for that. And we've thought about getting him an iPad. We've thought about everything. And I feel like he's 8. We've done PECS. We've done sign. We've done everything. But I can't seem to get him to understand.
How's he doing with PECS?
Because he's so tactily defensive. He really doesn't like PECS. And he seems like he might like the iPad, but he's got such a temper. I'm a little ambivalent about investing in one because of I know those cases say they're durable, but I'm sure we all feel that way. Like, have you really met Colin? Like, he really has a good arm. So but I feel like we're a little trapped because he just rehearses every word he knows to say, and then he's memorized the answers to every regular question. Okay. So people overestimate his skill set. But if you say, are you a boy or a girl, he'll say girl. If you say, are you a girl or a boy, he'll say boy. Okay. Because he doesn't really understand.
So he's using more echolalic type language.
He's very echolalic.
Okay. And so, echolalia is when kids will they imitate what they hear. Some kids imitate things from TV shows or what they hear people saying and things like that. Sometimes it's purposeful, sometimes it isn't. And it sounds like he has a big vocabulary because of echolalia. but it's not, it doesn't have symbolic representation to him. He's just imitating it. He's just saying it. And kids use echolalia for different reasons. Sometimes it's to block out what they're hearing. Sometimes it's to help them process what they're hearing so that they can understand it. So, I guess I didn't talk a lot about like how do you work on receptive language and understanding and things like that. So, but you really want to tie a symbolic meaning to an actual item, so, when you have a cup in front of you, saying cup, touching a cup, so as many ties as you can give to the actual item, whether it's a sign, it's a word, it's a picture, it's use of all of those things together. So I think building on that could help, definitely 8 years old. He's not too old to learn to use one of those types of communication systems. So, yeah.
Hi.
Hi.
So I have a question regarding, we got my son's diagnosis more recently. He's 9. And so one of the things that they said that he had was a mixed expressive receptive language disorder. And I'm just wondering, what's the difference between that and a central auditory processing disorder? Are they pretty much synonymous?
No,
Okay.
They're very different, actually. So a receptive language disorder is when the child doesn't understand certain concepts, certain vocabulary, that sort of thing. Central auditory processing disorder is when kids have difficulty processing the information. So they're hearing it. They may know like what, put the ball in the box. They know what in means. They understand that word. They understand that preposition. But then when they are given a complex statement like that, they don't process it correctly. They may put the cup in the box instead or something different. So they're just not processing the language. There are, that also is a very specific type of treatment. If your son was diagnosed with CAPD, which often is diagnosed around, 7 or 8 years old by an audiologist, there are speech pathologists who are specifically trained in working with kids who have CAPD.
That was my next question. So programs like Fast Forward and things like that.
Yes.
Do you consider those useful? Because there's so much mixed reviews regarding that. Like,
well,
whether
I think any treatment, even like specific treatments and the commercialized things, that you hear that are out there, they're all somewhat controversial. And I would say if you're looking into a specific treatment program, see what is research-based. You can look at ASHA's website, American Speech Hearing Association. Yeah. They publish evidence-based data. They encourage us to use evidence-based practices. And that's all based in research, what is researched and proven to work. So, I would encourage you to maybe look into that a little bit. But, as children get older, regardless of the deficits that they have, we want to focus on strategies. Like, what are strategies that we can use to make them successful? So it could be with him, repeating back, directions if he's able to, that are given to him, providing visual strategies to help him process the information, because we can improve his processing, but it may always be challenging for him. And as adults, we have strategies we can use. We write things down in our planners, we take notes, but kids need help with learning those types of things.
Okay, and then one last question. In terms of what I see with him sometimes, and I know other people experience this with their kids, that sometimes there's this sort of going backwards in development before a language burst, or is that a true phenomenon, or is that just is there research around that? Is that something you've seen, or is that just me making it up in my?
No, I don't know about with older children, but oftentimes, well, I would say with most kids, when they are working heavily on another skill, like the development of a motor skill, gross motor or fine motor, oftentimes one other area will kind of be put on the back burner for a while. So sometimes, when kids are learning to walk or they're really focused on some type of fine motor activity, then their language skills may kind of be on hold for a while. And then once that motor skill becomes a lot more automatic or easier for them, then they can start picking up with language learning again.
Hi.
Hi.
I get my question's more so like my daughter's going to be 12 next month.
Okay.
And my question is, at what point do you decide which form or which because she's as the years have gone by, she's been really good at different things. She's been good at picking up sign, really good.
Mm-hmm.
But her teachers have always said, oh, well, that's just going to kind of slow down the talking process. And then
That's not true at all.
and then and so they kind of did like elementary more so. They did work like with basic sign, but they didn't really push it too much. And then now she started middle school. This was her first year in middle school, and now it's like the sign is, I'm thinking, is more so as getting eliminated, because they say that it's kind of dying away, or there not a lot of people use it, so not a lot of people will be able to understand her.
Okay.
And then now she's using the electronic device, like the iPad, but then her teacher now says that will also make her, but then I see on there that there are studies that show that it helps.
Yeah.
So at what point, does one decide which way are you going to communicate? Because you're going to be 12, and we want you to be able to at least use whatever way or form of communication that will be most effective, as opposed to, oh, well, that's not going to work, or now this is not going to work. And now she's at a place where it's like she knows more than she can say, and now it's she's getting a little more on like the aggressive sense. And she's never been aggressive. So it's like I want to be able to make a wise decision on like how to decide on what's going to be her communication method, because she's pretty good at being flexible and really wanting to get, what I mean? So I don't know how to make that decision. What can help me make that decision at the same time?
Well, maybe you can take a look at the communication matrix that I talked about a little bit earlier. That might help you kind of decide on, let me see if I can find that right here, Design to Learn. That can help you kind of decide. But then also I talked about total communication, where, it's okay to use gestures, sign language, a device, in certain situations. One may be more useful or more efficient than another. But I would make sure that your daughter and you and her educational team and therapy team are all well trained in the communication system that she's using, and that it's accessible to her at all times at school or wherever she is. And also the goals that you have for her. What's important to you. Do you want her to be able to talk to friends? Do you want her to be able to order food in a restaurant? So think about the things that you'd like to see her doing, and that can help you determine which system would be most effective. If it's ordering food for herself in a restaurant, a waitress may not understand sign language, but she could understand a voice output device like the iPad. So I think kind of thinking about that too.
Just one last question, and we'll have to move on.
Thank you. So our daughter is 11, and she basically does not have one of these diagnoses. We feel like she may have apraxia, and who knows what else. But her communication is very basic. I mean, like minimal signs, more for pretty much everything.
Okay.
Or please for pretty much everything.
Okay.
But she, like I said, she's 11. So with us, wanting to maybe find a speech pathologist to figure out where she's at, is she too old to gain communication skills, like maybe with PECS or signing or whatever it may be?
No, absolutely not. I mean, kids and teenagers and adults, we work on communication throughout the lifespan. So, yeah, and it sounds like she has some communicative intent. She's signing more, she's signing please, so she wants to express something. She understands the cause effect of communication. I sign and I get something. So I definitely think you could use some of the pre-linguistic strategies and sort of expand on that. Did you get this website here? Okay, look at these video clips, and I think you'll see some ways that you can sort of expand on what she's doing. And then I'll also make sure that I get the slides to the website so you can look at those too.
We have done a lot of work with someone, but she's hard to tell when she gets a sign, she uses an old sign. Every time she learns a new sign, she uses
So she's not understanding the symbolic relationship. She understands the cause effect. So her sign of more and please is basically just a gesture of give me that. It's not I want more goldfish crackers or So we'd have to go back and teach her the symbolic representation. So she's not ready for that yet. Yeah. Okay. Thanks a lot for having me today.
Thank
It
you
was
very
really
much.
a pleasure.
Thank you.